Hi guys, this is my Educating Exceptional Students final module project. So the first thing we have is a communication disorder, which is any disorder that affects an individual's ability to comprehend, detect, or apply language and speech to engage in discourse effectively with others. There are four main types of communication disorders. They are a language disorder, a speech sound disorder, child onset fluency disorder, which is stuttering, and social pragmatic communication disorder. To better assist in the classroom, if you have easy interactive communication within the classroom, encourage each student to participate with discussions and activities, and also be patient when the student is speaking, because it may take them a little bit longer, and you wouldn't want them to get agitated or irritated. And also developing a procedure for students to ask for help when it is needed. Next, we have ADHD, or attention deficit hyperactivity disorder. This disorder is a mental health disorder that can cause above normal levels of hyperactive and impulsive behaviors. People with ADHD may also have trouble focusing their attention on a single task or sitting still for a long period of time. There are a couple causes for it. It's mostly brain injury or premature birth that can cause somebody to have ADHD. Some of the things you could help with this in the classroom is reward good behavior. It could be with a sticker chart or anything like that. Limit the distractions that they have. So try not to put them next to somebody that's going to distract them, or have like a bunch of materials out that they might get distracted with the materials. Give breaks often. If you're sitting for a long period of time doing some kind of project, after the project, if you give them a break before jumping into some other activity, and just support them when they're in the classroom. Emotion and behavioral disorder. This emotional disability characterized by an ability to build or maintain satisfactory interpersonal relationships with peers and teachers. It can be caused from a brain disorder, stress, or even family functioning. Behavioral disabilities include hyperactivity, aggression, immaturity, and learning difficulties. What helps with this in the classroom could be having class rules, making sure everybody is abiding by the same class rules. Again, rewarding positive behaviors and allowing break times as well. Intellectual disability. This learning new skills more slowly, and then also having difficulty problem solving with logic thinking. This can be caused by an illness or head injury, also with problems during pregnancy or at the stage of giving birth. What helps with this is teaching one step at a time, as well as one concept at a time. If you're teaching too fast, it's harder for somebody with intellectual disability to fully understand, as they do learn those new skills more slowly. So they do need a slow-paced teaching. You can provide verbal and physical prompting to guide to correct answer to kind of help them and encourage them more to learn and participate. Autism. This is a development disorder that is characterized by difficulty in social interaction and communicating, and by restricted or repetitive patterns or thought and behavior. The causes for autism could be a genetic mutation, low birth weight, being born to older parents, or having somebody with autism as an immediate family member. For this, if you give students simple choices to have a sense of control, let them have some say in what they're going to be doing next with those choices. So it seems like they're choosing, given those choices. You could also allow de-stress times, being in a classroom, hallway, anything like that with a lot of noise and a lot of people can be stressful at times. And teaching time management with timers. People with autism don't really have a sense of time. So having those timers and being able to teach them how long they're doing something or how long it's been since they've done something helps out as well. Traumatic brain injury, or TBI. This is a disruption in the brain that can be caused by a penetrating head injury, a bump, blow, or jolt to the head. TBI is mostly comes from a result of a car accident or a severe sports injury. A lot I know has come from like football injuries if they're being tackled and hit too hard. For this, if you give directions one step at a time, instead of giving like multiple steps or a long list of steps all at once, be flexible and patient, and then demonstrate new tasks or activities. It's helpful for this too to kind of do like illustrations with like demonstrating new tasks and activities. Like when you're giving the demonstration, if you use illustrations on showing the different steps and what they're going to be doing next, that helps as well. Then we have hearing loss. This is partial or total inability to hear. They may occur in one ear or both ears, and you can be born with it or it can happen anytime after birth. So for this, it's best to have the student sit in the front of the classroom to be able to better hear. It also helps for them to be in the front and the middle because they also have a better view of what's being taught. And I know people with some hearing loss or full hearing loss have a better understanding when they're reading lips. So if they're able to see you teaching and be able to read your lips, they'll be able to mouth read those instructions that are given by the teacher. Also, when other students are answering questions or asking questions, it's important for you to repeat what those questions or answers are, so that way that student is able to take in that as well. And also keep instructions brief as much as possible. Don't give a lot out, or if you're saying too much, it may be hard for them to keep up even with the lip reading. Next is visual impairments. This is the decreased ability to see to a degree that is not fixable by the use of glasses. It can be caused by an eye injury or an infection of the eye. This you would have to help with providing visual aids and encourage the student to actually use them, because some people don't like to really use them, so that encouragement helps them. With this one as well, if you seat the student towards the front of the class, preferably towards the middle as well, so that way they have a little bit easier time of being able to see. And also giving clear instructions. If it's not clear to them, it's kind of hard for them to understand what is going on. And that was the last one. Thank you, guys.